There's certain things going on in the winter that affect our skin. Number one is more transepidermal water loss, which means water's leaving our skin more dry. Our skin cells are turning over less frequently. We have less new skin cells going on in the colder weather. So if you think about brick and mortar, a brick wall, the bricks are the keratinocytes, the skin cells. The mortar, the material in between, is kind of the ceramides and the lipids. So many things are going on during the winter. And it's not really about maybe changing up your regimen, but just making sure you're sticking to a good skincare regimen, taking care of your skin.
It's sensitive but tough. It keeps you cool and keeps you warm. It can be dark, it can be light. It can stretch and it can shrink. It's much heavier than you think. It is our most visible organ. It's the skin, and we're here to talk about it today. Hello and welcome back to The Vitals, the Mount Sinai Health System's groundbreaking roundtable video podcast. I'm your host, Leslie Schlachter, a neurosurgery physician assistant here at the Mount Sinai Hospital. As we navigate the coldest stretch of the year, our skin often feels the impact first. Tightness, dryness, unexpected flare-ups, and that constant battle to keep moisture in and irritation out. Today we're diving into what really happens to our skin, especially in cold weather, and how to protect it with strategies rooted in dermatologic science, not skincare myths. We'll explore the essentials of barrier repair, why your routine might need a seasonal shift, and how medical and cosmetic dermatology intersect when it comes to keeping skin healthy, resilient, and comfortable all winter long. To walk us through this, we're joined by Doctors Helen He and Dr. Nicholas Brownstone, two dermatologists here at the Mount Sinai Health System. Welcome. I'm so happy to have you guys here. Thanks for being here.
Thank you for having us.
I have waited a year for this topic. I asked for this like over a year ago. Not that I don't love other things about healthcare, but I really care about my skin. And I think a lot of people care about their skin. It's beginning of winter now. It's changing. So I want to talk about skincare. There's so much to talk about with skin, but I want to talk about skincare, but I want to start off with like winter skincare. So, why don't you guys kind of just generally talk about like the basics of skincare, and then we can kind of get deeper as needed.
Sure. Well, first of all, it's great to be here. I love dermatology, love talking about dermatology, so this is really a pleasure to be here. So we can talk about winter skincare, but we have to talk about basic skincare first, which is winter skincare as well. And I'm a simple guy. I like simple things, straightforward things. So I talk about the KISS method with skincare, okay? Keep it simple, stupid, okay? Mm-hmm. We can make skincare so complicated. There are thousands of skincare products out there, but there's three important things when thinking about skincare. It's cleanse with a cleanser, okay? Support with a moisturizer, and then protect with SPF sunscreen, okay? Those are the three most basic things of any skincare regimen. If you do those three things, you're going to be doing a pretty good job in the first place.
You just put like half the skincare industry like out of business with just that, because there's like a million other things they want you to buy.
There's a million other things. And I'll just add one more thing before we really jump into this. It's so important, okay? As I said, there's thousands of skincare products out there that claim to slow aging or reverse aging. There's dozens of devices, lasers, energy-based devices. Dr. He's an expert in these. I do these as well. But there's two things you can do over your lifetime to significantly enhance the beauty of your skin and the health of your skin, okay? And I call these the ultimate skincare secret because they're so simple, but so important, often overlooked. And these two things are don't smoke and wear sunscreen, okay? If you do these two things, they will be better for you than any cosmetic lotion, moisturizer out there, and any cosmetic procedure, even though these things do work and they're important, but these two things are very important. I'm sure Dr. He would agree with that.
Yeah, and I just want to add to your point that there are millions of products out there. So how do we pick between those? You really want to keep it targeted to your skin needs. Just because something works for your friend or for somebody else does not mean it's the right product for you. So you have to think about what my skin needs, what my skin concerns are.
I like that word.
Really,
skin concerns.
Skin concerns. Yes, that's really intentional.
Call it Merriam-Webster. That's a great word.
Let me trademark that one.
Yeah, I mean, that's hard to do because that's not the way products are marketed to us. You see, I am for sure a product of marketing. I will absolutely buy the product that looks fancy or that TikTok says for me to buy. So how do you know what the right products are for you? Like, is it ingredient specific or is it just like dry skin, oily skin? How do you know?
So for me, it's ingredient specific. So like Dr. Brownstone said, the foundations are cleanser, moisturizer, and SPF. Those are non-negotiable. For everything else, the serums, the toners, I like to look for what ingredients are in them and whether those ingredients are beneficial for the skin concerns that I have. So if I have acne-prone skin, for example, I want to find ingredients in my skincare that can combat acne. If I have hyperpigmentation, I might want to find products that contain ingredients that can help fight pigment. So that's just an example of, how we want to.
What are some of those ingredients? Let's go acne first.
Yeah, so for acne, for example, retinoids, salicylic acid, there's certain antimicrobials, certain anti-inflammatories that you can incorporate into your skincare. In the winter months also, one trick is that you want to find a thick moisturizer, but you want to make sure it's non-comedogenic. So whether it's makeup or skincare, you want to make sure all of the products that you have or that you're using are not containing comedogenic ingredients.
Meaning that word means like blocking pores
Yeah,
to
things
make
that can
like a
block
pimple or
pores.
something.
Exactly. So ointments, for example, they can clog pores and people can break out for them. So that's just an example of customization of skincare. If you're acne prone, maybe don't do an ointment, don't do a Vaseline.
Right.
Yeah.
Right. And then what about, my age group, the 45 and up? I'm looking to reduce wrinkles, keep my skin plump, and get rid of my hyperpigmentation. And like products only right now. I know there's like lasers and all that stuff.
Right, right. Yeah, it's a good question. The cornerstone of skincare, cosmetic skincare, is tretinoin or retinoid, which Dr. He knows a lot about. All dermatologists know a lot about that. Retinoids are vitamin A derivatives. They have a wonderful array of effects in the skin, helping the skin cells turn over faster, thinning out the top layer of the skin, building collagen, blocking some of the enzymes that break down collagen in our skin. So tretinoin is a wonderful product. Now, over the counter, it's adapalene. It's a weaker retinoid. You might get a prescription from your doctor for tretinoin, a little bit of a stronger retinoid, and these work great, okay? So everyone should be using tretinoin if they want the anti-aging effects, wrinkle reduction and pigment reduction. It also helps with acne, which is great. The issue is, though, it does cause redness, peeling, and dryness, which are exacerbated in the winter. So we tell patients to use tretinoin to start slow, maybe once every third night, once every other night, and then once daily if you can work up to that.
So you build up your tolerance.
Build up your tolerance, that's right. And it's especially important to moisturize in the winter and be aware of this in the winter because tretinoin, acne medications, they're extremely drying. Whether we put topical acne medications on or take oral acne medications, namely isotretinoin, commonly known as Accutane, this is extremely drying and only going to make things worse in the winter. So for an acne-prone patient, when you're asked about skincare being customizable, if you're prone to acne or taking acne medications, in the winter, you have to be aware of these things, that they'll be worsened.
What are your thoughts on all of these new estrogen face creams that are coming out? They've been out now. It's been like 2 years now, like heavily marketed towards my generation. And I use them. A lot of women have been estrogen replacement for a long time, but now there's estrogen creams that you can put on your face that specifically they target you to say, this is what's going to improve the collagen, the fibrin, it's going to boost your skin. Does it work?
Yeah, you're totally right. I think what you're getting at is the studies have not been exhaustive yet. There's not been randomized, double-blind, placebo-controlled trials with these medications, which is the gold standard in medicine for testing a new product. We don't have a ton of research supporting.
All right, so before we go into does it work, do you think it's harmful?
Yeah, so when it comes to some of these hormonal therapies, there is, of course, HRT, systemic estrogen replacement, and there are definitely studies that have shown that estrogen replacement for those who are candidates, if there are no contraindications, can be beneficial for skin health. Topical estrogen products can be an alternative to systemic hormonal replacement for those who are concerned about systemic hormone effects. When it comes to topicals, there are plant-derived phytoestrogens, there are selective estrogen receptor modulators. There's even a product on the market that's able to deliver the effects of the beneficial effects of estrogen to the dermis of the skin, but then it gets metabolized so that we're bypassing some of the systemic hormonal effects that are unwanted.
I'm 46. I really care about my skin. I stopped going into the sun. I mean, I wear sunscreen hats and all of that now for the past decade. 2 years ago, I looked at myself in the mirror and was like, okay, yeah, I see it. So I called my dermatologist here at Mount Sinai and said, what can I do? We went on a more aggressive tretinoin journey. We talked about lasers. But I did a telehealth visit with a company where I then received this estrogen cream. They also do regular estrogen replacement and stuff like that, progesterone, testosterone. But I use an estrogen-based cream, Estriol, on my face. And I would say I think it's made a difference. But if I really did not look into the research for it, but I just hope I'm not hurting myself. Can't imagine I am because everything seems okay. I think there's very little systemic uptake.
Right. So when it comes to these estrogen creams, estrogen medications in general, you know, so starting with hormone replacement for those who are candidates, it can actually be very beneficial for the skin. But with that, there is the concern of hormonal intake and unwanted systemic hormonal effects. With the topical estrogens, are they going to be quite as effective for your skin health as the systemic estrogens or systemic hormone replacement? Probably not. Is there a lot lower risk of systemic absorption and therefore these unwanted hormonal side effects? Yes. So for all intents and purposes, I think they're quite safe.
It sounds like your skin regimen should change as you age and with your skin type. But what about seasonal? Should you be using like the same regimen all year long, or should you be rotating based on season?
It's a good question. Of course, when the seasons change, the weather changes, and there's certain things going on in the winter that affect our skin. Number one is more transepidermal water loss, which means water's leaving our skin more dry. Keratinocyte or skin proliferation is also affected in the winter. Skin cells are turning over less frequently. We have less new skin cells going on in the colder weather. The lipid bilayer that makes up our topmost layer of the skin's affected. So if you're thinking about brick and mortar, a brick wall, the bricks are the keratinocytes, the skin cells. The mortar, the material in between, is kind of the ceramides and the lipids. That integrity of that bilayer is also affected. So many things are going on during the winter. And it's not really about maybe changing up your regimen, but just making sure you're sticking to a good skincare regimen, taking care of your skin. When you're thinking about a moisturizer, there are two main categories. There's humectants and there's occlusives. So occlusives prevent water from evaporating off the skin. Humectants draw water in, okay? The best moisturizer that's been studied is petrolatum, petroleum jelly, Vaseline, very greasy. We're all aware of that. This is an occlusive. It blocks water from leaving the skin. As Dr. He mentioned, this could be comedogenic, though, in some cases, so might
also
not...
Also very uncomfortable.
Yes.
Like your hair sticks to it, your clothes stick to it.
Yes.
It's not fun.
But let me tell you, it's the most effective vehicle, the most effective moisturizer. And a lot of doctors in dermatology give out topical medications. We're all aware of that for different kind of skin diseases. We have lotions, we have creams, we have foams, solutions, shampoos. I always tell patients to use an ointment, and they get mad at me sometimes because ointments are the least cosmetically agreeable vehicles, but they're the most effective at penetrating ingredients and blocking water. So get back to your question about what happens in the wintertime. Not so much different products, but just sticking to really good skincare, and this is what you're going to want to do. And these are some mistakes I see from patients all day long in clinic. I see these mistakes at least once a day. One is hot, long showers, and I'm guilty of this. I love doing this after a day, cold day, outside, whatever, walking around. You know, taking a long hot shower is really going to dry your skin out, okay, all year round, especially in the winter. Using harsh soaps, high alkaline soap. We want gentle Dove soap, okay? In addition, we want to moisturize properly, okay? And that's twice a day after you bathe, ideally. And I tell patients, you know, you have a nice apartment and a nice car. Yes, I do. Do you clean it? Do you upkeep it? Yes, I do. Well, your skin's the same thing.
Right.
You got to put work into your skin and upkeep it like anything, like flossing your teeth, brushing your teeth.
We're talking like all the skin.
All your whole
skin.
body. So the way you do it is ideally twice a day. Especially after you bathe, you're going to want to pat your eye and then moisturize when your skin's a little bit damp to really lock that moisture in with a good occlusive type moisturizer. And then, you know, if you stick to those things in the winter, that's really going to help support your skin health.
So do you go to bed like slathered in Aquaphor?
I do sometimes, yes. And it's uncomfortable.
Oh my God. I feel bad for your sheets. You're like just sticking to everything.
Yes, it's uncomfortable sometimes. And sometimes I've overdone the Aquaphor, the Vaseline on my face, on my body. But it's all a balance, you know. So those are some good skincare tips. Mistakes that I see, ways to support your skin, and extremely important if you a patient that suffers from eczema or atopic dermatitis. We want to make sure we're doing those things as well in the wintertime.
So products is just like one part of it. And we're lucky now that there's a lot of technologies that we can use. There's like lasers and lights and all these things. You specialize in this, right?
Yes, I do a lot of cosmetic dermatology.
So can you talk a little bit about, I want to do like technologies, lasers, and then make our way into like Botox fillers, injections and things. How can there's looking better and then actually improving the skin? Can you kind of talk and break them up?
Yeah, so I do a lot of fun things in my clinic. As you said, plenty of lasers and devices that can address a variety of skin concerns. And I just have so many in my arsenal. So I have lasers that help with anti-aging and rejuvenation. So on the histological level, that equates to increased collagen production, helps with the appearance of fine lines, wrinkles, skin texture and quality. I have devices that help with skin laxity, so loose skin. I have lasers for hyperpigmentation, for redness, for acne scars, for removing
How many
hair.
lasers do you have?
Probably more than 10.
That's a lot. Where do you keep all these lasers?
We
Yes.
have
Yeah,
space
you
in
make-
our
you make
clinic. We
space,
make
yeah.
space for these, exactly. These really can treat a myriad of different skin concerns. So we really target the treatment plan, whether it's skincare or with these laser procedures or these devices, for the individual patient. And hopefully, and that helps them not only, look more youthful, look more rejuvenated, but hopefully feel more confident in their own skin as well. With lasers, I think we are also kind of shifting away from just one-off cosmetic procedures or shifting away from just treatment and correction to also prevention and providing holistic care with these devices, also in the context of skincare and cosmeceuticals, lifestyle modifications, in some cases medical treatments.
Right.
As
So
well.
if you're like drinking and smoking and sitting out in the sun all day, like it's like taking double Lipitor because you want to eat pizza. You don't just like show up to the clinic and then laser yourself.
Yeah,
You're
patients
just like
come
chasing
in,
your tail.
and I do some of these too. They ask for lasers, energy-based devices, and I say if you're not wearing sunscreen and if you're smoking, then I wouldn't even waste my time and effort with this.
Yeah,
because,
like I don't want to take your money.
Right.
It's a whole package.
Yes, yeah, exactly.
Because otherwise, like you said, it's taking one step forward, two steps back.
What's your favorite laser?
Oh, that's so hard. Lately, I've been loving the CO2 laser. You do get some downtime. You do look a little bit crazy for a few days, but
Do you
it's
look
just
crazy or is it also like painful, like sunburny painful?
maybe for during the procedure, it can be a little spicy. The day afterwards, it can be a little bit. You could be kind of red,
Yeah.
swollen. Like it kind of feels like you had a sunburn.
Right.
But the results can be really dramatic. Yeah.
Do patients when they come in, are they generally coming in saying like, hey, I'm interested in laser, or are you guys generally providing like, I think you would do great with a laser? How does it usually work?
Sometimes they'll come in asking for a specific device, but in most cases, that information isn't necessarily out there. And there's just so many options. It's kind of like information overload, really. So it's more commonly a patient will come in and just say, hey, I'm not really feeling my best. I'm not looking my best. I feel like I look tired. I feel like I look older. What can I do? And then that's where this combination multimodal approach comes in, where often it's one procedure, often it's a mixture of different procedures, both lasers and injectables I do, like Botox and fillers, that's a category of things as well. But we're having a discussion even beyond that to the skincare they're doing, to lifestyle modifications. So it's kind of a holistic care type of approach.
Are the injections still as popular as they were years ago? Or are we kind of fading away from that
They're
with all
still-
these lasers?
They're still quite popular. I do plenty of neuromodulators, Botox being the most popular one for relaxing wrinkles, for softening the appearance of fine lines. Fillers for volume loss. I think one trend with injectables that we're seeing is a little bit less of filler and a little bit more of what we call injectable biostimulators. So biostimulators are injections that help to promote collagen. So it's basically stimulating your body to do its own work of making new collagen, making new
What's an
elastin.
example of one of those?
So
they?
brand
Brand name. It's okay to say brand names.
Brand
Yeah.
names. Okay.
Yeah.
So Sculptra and Radiesse are the most common ones.
So they don't just like take up space. They actually
don't just-
work to improve.
Exactly. They don't
Okay.
just take up space. They don't just volumize the way filler does, but they're actually inducing your body's own collagen production. So that way, many people prefer that because it gives you more natural and longer lasting results compared to
I feel bad for the rest of the
fillers.
body because we're focusing on the face, but it is what we look at most every day. But like all these things that we talk about, like improving face, because that's what's outward facing. Do we have to also talk about that with like the neck, the chest, and the hands? Like these are also things that get as much sun and damage, right?
Very valid point. So when it comes to just preventative care SPF, for example, everyone cares about the face. Remember to SPF your neck, your hands, all the sun exposed sites. Also to Dr. Brownstone's point, so many people, they'll make sure to always moisturize their face, especially in the winter time, like after like a long hot shower, that moisture is just going to be sucked out of your skin. So you really have to keep your entire body
I'm
moisturized.
guilty. I moisturize my face, my neck, my chest, my hands, and then I go elbows and knees.
Honestly, I'm guilty sometimes
Like
too.
it's like elbows and knees. I'm like, well, that's the driest.
You know, we have something in our skin called natural moisturizing factor, okay? And this is pretty straightforward. It's naturally occurring in our skin, and it naturally moisturizes our skin. As we get older, this natural moisturizing factor starts to decrease, okay? And not that I'm old, but I'm older than I was 10 years ago, obviously, and I've noticed this in myself. I need more moisturizer now, more lip balm. My hands are drier, as I've gotten older. And I think nearly every patient I see in my practice with elderly with wrinkles and sunspots has dry skin. Xerosis is the medical term for dry skin. You know, cracked. You can almost look like little.
Like fingers, heels.
Yeah, like cracked, dry skin, lusterless skin, dull skin, flaking skin. These are all signs of xerosis and dry skin. And nearly every elderly patient I see has xerosis, has dry skin to some degree because of this natural moisturizing factor. Another thing that's kind of impacted by colder weather as well.
What is your recommendation? It's so frustrating for me because I see a lot of older patients. As a neurosurgery PA, just the demographic that I find myself taking care of is, the older, over 60, 70 crowd. And the skin on their shins makes me crazy, right? So they develop peripheral vascular disease. It's paper thin skin, and it gets damaged, it bleeds, it's bruised. What's your recommendation for protecting that skin?
That's a difficult problem.
It is. It's
That's
very
a really difficult.
difficult.
If you can figure that out, you'd be a billionaire.
Well, I was thinking, here's my thought. You know how we have, first of all, I never understood why old men always wear their white socks all the way pulled up. And I realized, they're just protecting their skin from getting banged. What about a compression sock, but the actual inside of the sock from the ankle to the top has like a gooey plastic coating in it, almost like it's an Aquaphor, but it's not. That's what I want.
That's kind of patent pending, I think.
Yes.
So
That's what I want my father-in-law to wear every day.
Yeah. So not compression stockings, but that actually is very similar to a tip that I give for patients during the winter. Those who have very dry, cracked hands and cracked feet, where no matter how much they moisturize, it's not sufficient.
Yeah, it's just not enough.
So one thing that I recommend patients do in that case is I'll have them before bedtime slather a thick moisturizer on their hands or their feet, let's say,
Right.
and then put on clean 100% cotton gloves or socks and go to bed in them. It's basically
Or even
like
just
a
socks.
mask. Yeah, exactly.
socks, that's
Just
good.
something 100% cotton, something breathable. It's almost like a mask for your hands or a mask for your feet. And it just really allows those beneficial ceramides and moisturizing ingredients to penetrate the
Is that
skin.
how you sleep? With your hands slathered in Aquaphor, just sitting in mittens?
That's kind of funny.
It's surprisingly comfortable.
If
Yeah.
anybody-
I can
Yeah.
imagine.
They could blackmail me if they found that picture of myself. But yeah, to answer your question, it's very hard to treat thinning skin. It happens as we age. Bruising of the skin gets thin. That's extremely hard to treat. We don't have any great therapies for that. But as Dr. He said, that's a great tip for dry skin, especially in the winter. Our hands get very dry. Especially we have many people that do have difficult jobs in the service industry, bartenders, restaurant workers, cleaning house cleaners, and they're constantly exposed to wet work, washing dishes, harsh soaps, cleaning fluids that could damage the skin. These patients need even more support. And the best way to support them is to have them put a very thick moisturizer on with a glove overnight. I think there's been studies done. The medication penetrates, or the medication works like 100 times better because of just that occlusive effect of that plastic wrap or that glove on. Patients that have medical skin disorders like psoriasis, like atopic dermatitis, you can even put a topical medication on and wrap it with saran wrap, and that will also help that medication penetrate 100 times more. Just don't use a saran wrap on your food afterwards. Please make sure to throw it out.
Yeah.
But yeah, it's a great trick in the wintertime for very dry, cracked hands, very dry, cracked feet. Wrap it in saran wrap. Put a medical glove over your hands, and then go to sleep in the morning. I think be a big help.
This is such a diverse topic because I'm sitting here, I'm thinking, like, how are we going to make our way to skin cancers, skin disorders like eczema and psoriasis? This has to be a two-part series.
Well,
for
this
sure.
could be a whole 12-part podcast
Yeah,
series on skin. I mean, there's over 3,000 diseases that a dermatologist has to learn how to diagnose at the histological level, on the skin when they graduate residency, as well as addressing cosmetic concerns. I mean, many doctors think dermatology is easy, but dermatology is actually very difficult because of the amount of diseases that we have. And it's not like in some fields where, okay, your blood pressure.
And it's a sign for a million other diseases that the skin is just a symptom.
Yes, you can catch an internal cancer or an internal condition. And in dermatology, a lot of things on the skin, it's not that straightforward, you know. The hard thing about dermatology is we have a couple of pictures in our textbook, many pictures in our textbook of skin disease, but it can present in so many different ways in the skin,
Right.
and that's what makes dermatology difficult.
Right.
The skin is also the only organ of the body that's directly exposed to the outside environment. So with that, I think that the skin can often be a lens for what's going on the inside, whether it's systemic diseases, whether it's just your overall health. It can tell you a lot, actually.
I posted something on my Instagram a couple weeks ago about, because when I meet with patients, I say, who's your primary care doctor? Who does this? Who does that? And they're like, I don't. So I did a series of telling patients who they're supposed to be seeing every year. You're supposed to see your dermatologist every year. You're supposed to get checked and make sure everything looks okay. What age does that start? Like, what age do you say to patients, like, you really should come in every year?
It's going to depend a lot. For those who have a family history of skin cancers, especially a history of melanoma, because that can often be genetic, you want to start at a very early age. For those with lighter skin types, where their skin is just going to be more sensitive to the sun, because many of these skin cancers are a direct result of UV exposure for the sun, you might want to start at an earlier age as well. So it's
So let's
really
say
going
no
to vary.
risk, not super light. 30, 40? What are you saying?
Really at any age,
Any
because
age.
skin disease affects 1/3 to 1/4 of American citizens. Over 100 million Americans have skin disease. Just by the fact that acne, 90% of patients, 95% of patients
Untreated acne.
in their life will get acne.
Yeah.
No one ever died from acne, but it's extremely life-ruining, and even mild acne can become scarring. So patients can come in at any age for a skin exam, not necessarily for skin cancer, but to look for things like acne, look for things like warts, look for things like eczema.
Ringworm.
Yeah.
I'm like on the beach and I want to be like, do you not see that? Do you not see the ringworm on your body?
Extremely
Go
common,
to a dermatologist.
extremely common as well.
I haven't learned how to actually say that out loud to a stranger. Like, by the way, that's ringworm. What would you do? You see someone on the beach clearly has ringworm. Do you say something?
I've been tempted before. Yeah.
Ringworm, maybe not.
Well, not specifically.
If it's a skin
ringworm.
cancer, then I would say
Yeah.
something. But yeah, so in terms of coming in for a skin exam for skin cancer, there's no guidelines on that. As Dr. He said, she's correct. If you have a family history of skin cancer, if you've grown up in a very sunny environment, if you've not worn sunscreen, if you have a lot of moles, especially what we
Right.
call dysplastic moles, which are moles that don't look exactly 100% normal, if you have freckles, if you have red hair, if you have blue eyes, fair skin, these are all risk factors for skin cancers. You might want to be seeing a dermatologist in your 20s and your 30s versus somebody who doesn't have those features. 30s and 40s might be reasonable, but it's all tailored based on your individual risk.
How close are we to, like, you go to the airport and you stand like this? How close are we to, like, the AI dermatologist that does, like, a 3D scan and says, you're good?
I think tools are getting more advanced and they can aid us in diagnosis and making treatment plans. But frankly, you really want to have a professional, like a dermatologist, looking over your skin, because you really don't want to rely on a machine or AI tool to be the final verdict for whether you have a skin
So
cancer.
no AI
right?
technology yet for you guys?
No, I always say AI is going to support but never replace.
Right.
And these are very, very complex things we're dealing with. A lot of subtle differences under the microscope and on the skin. I don't think AI is ever going to get there to totally replace, but it will support.
Yeah, there's nothing like laying there naked in front of your dermatologist and they say, flip.
Right.
We don't want to give that up.
Right. No, I really enjoy them because you get to pick up things. If you catch a skin cancer, it's very gratifying.
Yeah.
You get to pick up other skin diseases that patients may not be aware of, an early wart that may spread. You can educate them about good skin care and good sun protection, which is ultimately the most important thing in skin cancer, is to prevent, right? Is to have good skincare regimen. And just tell patients things they might not even really be aware of. For example, going up high in higher altitudes, skiing in the winter, your UV exposure is a lot greater at higher altitudes. There's more UV exposure.
Like even if it's cold.
Yeah, the UV is bouncing off the snow and hitting your face and causing a greater degree of sunburn. There was a study that was done years ago, which I love. It was a split face study, which means they took patients in Vail, Colorado who were skiing, wonderful place to go, in the summer and the winter. But these were skiers in the winter. They put SPF 50 on one half of the face, SPF 100 on the other half of the face, and that said go ski. And they found out that the SPF 100 side of the face got less sunburn, got less sun. In reality, SPF 50 versus SPF 100, not a huge difference in
I
terms
feel
of.
like that should have been like 1570 or something.
They did 50, 100 because the sun's so much stronger at higher altitudes up in Vail. The point is that 50 versus 100, maybe SPF 50, you're getting 98% blocking of UV, SPF 100 maybe 99%, but that's with ideal use, okay? No one uses sunscreen like they ideally should, okay? Patients come to me and they say,
Like slather it
yeah,
on.
they say my sunscreen lasts me the whole summer. I'm like, you're using it wrong, you know?
Yeah.
So with ideal use, patients aren't using sunscreen properly, as they should. So higher SPF is better in that case because you're getting some of that expert protection, especially up higher. The UV is more powerful. It's bouncing off the snow, hitting your skin. So patients might not know things like that. If you practice in an area in the mountains, good point for education, educating about ABCDEs of melanoma, what melanoma looks like, what to be concerned for, because ultimately it's a team sport here. You know,
Yeah.
As a dermatologist, I see you maybe once, twice a year for a skin check. You know your skin way more than I do, and you know what's changing, what's bleeding, what's crusting.
Or at least what we can see.
Right. And so I have to let you know what to look out for so we can help each other out. That's very important too. And you know, there's many professions that just have a higher risk of skin cancers. If the two professions that have the higher risk of melanoma are firefighters and airline pilots. Firefighters are in the sun a lot, exposed to carcinogens and burning buildings, all these pollutants, and airline pilots are again up at high UV ranges,
yeah.
you know, all day long. With the window does block some sun, but not the harmful rays. The sun's bouncing off some of the white clouds, and you know it'd be a good time to educate them. You need maybe more skin exams, more frequent skin exams than the average person because
I would
of your
never have
profession.
thought about a pilot.
Yes.
Yeah. Wow.
So there's a lot of opportunities to intervene early on skin exams beyond just looking for skin cancer, which I really enjoy as part of my job.
I had a patient last year who presented with seizure, was found to have a very large intrinsic brain tumor, looked like a glioma. The path came back, melanoma. Prior to the visit, you know, anyone who presents with a first ever tumor with no other underlying disease, it's typically a high grade tumor. However, if they have a history of some other cancer, it's 90% likely to be a MET. Well, this guy had no history of cancer of any kind. And so I said to him, this is either going to be a high grade glioma or you have a melanoma we don't know about. And once we got the path back, I immediately sent him to derm and they found the lesion, and like that probably could have been caught. Like that's why you get your skin checked. You know, it's serious. I mean, melanoma can be deadly.
Yes. You know, stage 1 melanoma, 99% survival rate. Stage 4, you know, 20, 15%. It's getting better with new immunotherapies. But melanoma is preventable, and if it's caught early, it's better prognosis. That's just a general principle in all of medicine, catching a cancer early. So, yep, educating on preventing, educating on what to look out for, and having skin exams is very, very, very important for sure.
So I want you guys both to answer our closing question, and I'm going to make it difficult. You already said like cleanse, moisturize, SPF, don't smoke.
Wear sunscreen.
Yep, wear sunscreen. What would be one thing that you want people to know about their skin that we did not discuss today?
Dr. He, you want to start?
So, one thing that I want people to know is that the wavelengths of light that penetrate and reach the skin extends beyond just UV radiation. We now know that there's also visible light, there's also infrared light, and visible light spectrum actually is the spectrum of light that's most responsible for causing hyperpigmentation, for inducing pigmentary disorders like melasma. So beyond just general SPF, for those who are prone to melasma, prone to hyperpigmentation, and really, don't like that, I highly recommend using a tinted mineral sunscreen to protect against those specific wavelengths of visible light.
That's what I use. I'm so excited.
Very good.
What about you?
Totally agree with that as well. Yeah, I love doing dermatology. Skin's the largest organ. There's ways to treat it and enhance it cosmetically, and we, of course, treat many skin diseases. And that I just, tell patients, again, the KISS method, keep it simple, stupid, cleanse, support, protect. If you do those three things, you're already doing a great job, and there's ways to get fancier. There's ways to tailor your skincare for your specific skin. But if you do those three things, you're already doing a heck of a job, a heck of a great job just with skincare in general. And the more things you introduce into your regimen, the more your compliance goes down. So I want people to worry about that and know about that as well.
That's a problem for teenagers.
Yes.
I have a 17-year-old, and I look at in her vanity, I'm like, this is, why am I paying for this?
What are
we doing?
We all live extremely busy lives, especially in New York City. So I just want to keep things simple. And if you're a busy person, you don't want to worry about all these different products, at least those three things. If you do those three things, you're already most of the way there.
Which part of your skin do you worry about the most?
Which part of my skin do I worry about? I think all my skin looks good, so I don't really worry too much. Maybe I should worry more.
You got to pick one part.
I guess around my eyes, I feel like as I age, that's the area that becomes more noticeable that I am aging. Mm-hmm. It's kind of like sagging skin, wrinkly skin.
So you have a more cosmetic concern.
More of a cosmetic concern,
okay.
Yeah.
What about you?
I think I would say skin around my eyes.
Also kind of cosmetic, the neck.
Yeah.
So the neck.
Hate the neck.
Yeah, hate it. Connected to your face. Often for a lot of people, like their neck ages faster than their face.
Yeah.
We do have, tools and devices that help with the neck as well, but just a problem area for so many people. Also gravity,
Yeah. I think mostly I put most effort into my face and my neck, but I actually worry most about my heels. They get very cracked. I think I need to start sleeping with socks in Aquaphor now, or Bag Balm or something. Yeah. Thank you guys so much for being here. This has to be like one of multiple, because we haven't even talked about like allergies, sensitivity. Like there's so much more.
You can have 100 series
like
podcasts
we're like
on skin disease
tip
and
of the
skin.
iceberg.
You could have 100 episodes and still not cover it all.
Yeah. Thank you so much.
Thank you.
Thank you. It's great to be here.
That's all for this episode of The Vitals. I'm your host, Leslie Schlachter. Subscribe to The Vitals and Mount Sinai Health System's other video podcast programming on YouTube, Apple Podcasts, Spotify, or wherever you get your podcasts. To learn more about Mount Sinai's work in skincare or to book an appointment with Mount Sinai experts, scan the QR code on your screen or click the link in the description below. To get in touch with the show or suggest an idea for future episodes, email us at podcast@mountsinai.org.